Hi, this is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. Today I'd like to present an interview with a patient we've been working with for the past 4 months. The patient came to see us with a variety of health issues, the most significant of which was heavy and severe vaginal bleeding and clotting, which had landed her in the hospital only 1 month prior to her initial visit. While under medical care, the patient received iron infusions, IV medications for low blood pressure, and Menstrual, a synthetic hormone replacement therapy. Despite such treatments, the patient continued to have symptoms and reported numerous and severe side effects of her medications. The patient also suffered with unstable emotions, body aches, headaches, digestive issues, insomnia, heart palpitations, and chronic fatigue, to name a few. In working with her, we performed a comprehensive case history, physical exam, and laboratory testing, all designed to uncover the underlying causal factors behind her health issues. After just 4 months of care, the patient reported a dramatic decrease in her vaginal bleeding, clotting, and inflammation, and much improved overall health and sense of well-being. This patient's case is a prime example of how we can successfully address women's health issues without having to resort to hormone replacement therapies and other alternative and medical measures, all of which only tend to further imbalance the body and lead to secondary health issues. The following interview is a detailed account of the patient's own experience with us at the clinic and the significant improvements that she has seen while under our care.
Good morning, it's Dr. Paul Goldberg of the Goldberg Clinic. We're here with Tina Depew today, who comes to us from Kathleen, Georgia, which is near Warner Robins, Georgia. And first of all, I want to say thanks to Mr. Depew for serving in the military. Tina's husband is currently over in Afghanistan. She's going to be joining them shortly in Italy, and thank you, Mr. Depew, for your service to our country. Tina came in with some problems that we're finding more and more commonly among our patients now regarding hormonal issues. And I have very serious concerns about what women are doing right now with their hormones. Rather than working to obtain good health, they're going to medical doctors, including many so-called alternative medical doctors and anti-aging medical doctors, and being put on all kinds of hormone replacement therapy, whether it's standard or bioidentical, rather than first of all addressing the very basic nature, the fundamentals and the essentials of good health. And by doing that, they're leading themselves to all kinds of problems. It's like trying to throw paint over a car without first washing it, and without first taking off the dirt, and without first taking off the old paint. Women really need to think about what are the issues behind their hormone irregularities and address the fundamentals, the foundations of health first, before they ever start thinking about taking any kinds of hormones, hormone replacements, or bioidentical hormones. Remember, just because something is natural doesn't mean it's good for you. We have a lot of concerns with women we're seeing on the so-called bioidenticals. They're having problems now, as well, of course, and even more so with some of these very strong hormones that medical physicians have women taking because of so-called hormone irregularities. So I'd like to allow Tina to tell her story of why she came to the Goldberg Clinic, what she went through here, and what's occurred. Tina, go ahead and tell us, including all the women out there who I think need to hear your very important story, what transpired that brought you here and what happened after you came here.
Okay, well, this December, right before Christmas, I think December 20th, I ended up in the hospital. I was hemorrhaging. My hemoglobin level was at 6. My iron was less than 1. So as soon as I went to the gynecologist, they instantly put me in the hospital. I had signed paperwork for blood transfusions. Thank God I did not need to have those, but I did have 5 iron infusions. During my stay there, they did put me on something that's called Nagaze. I believe the other name for it is Menstrual, which is the strongest progesterone hormone that there is out there. And I knew instantly once I had taken that I could not continue with that therapy. I only took that for 3 weeks. It did not help rectify the issues that I was going through. But with mine, all of my female issues, I would have to say, started back in '98 when I had my tubes tied, and it just came to my attention through working with you that I did have the 2 shots of Dupron Depot, back then, because I started having a lot of female issues after that. And then I basically quit seeing a gynecologist until recently, when I started having severe heavy bleeding over the last year and a half. Nothing seemed to ever make it better. Last July I had my right ovary removed. From that it whirlwinded me into the next hospital stay. Everything was always another hospital stay, another procedure, this or that. So luckily I called Dr. Goldberg, came up here, and with the work that we've done, I started actually doing the work beginning of March. This is mid-May, and my body has totally changed, and my cycles are totally changing. I'm not having the hemorrhaging no more. My mental clarity is back. My husband feels like he has his wife back. I've lost 20 pounds. My whole life is just totally changed back around again.
What would you advise other women to do when they have hormonal issues?
First of all, call this man. It definitely.
And in general, thank you, but in
Yes.
general.
Yes, in general, I would not advise going through the procedures, the hormones, or any of that, because it does not help with the issue that is going on, that the body needs rest. And then once the body gets the rest, we need the proper nutrition, and we need to get away from the chemicals and things. And just as you had said, we need to address the underlying issues of what is making us out of balance. Because no pill, no procedure, any of that has ever made any of my symptoms ever better. It has made them much worse.
So it's very important that we establish the foundations of health, allow people to have the opportunity to investigate and to confirm what the causes of their health problems are, address those specifically, allow the body to get back into balance. And no matter what the diagnosis may be, I think that's always the way to start. And usually that's all that's necessary to allow people, including women, to get back and enjoy a good, stable, healthy state of well-being. And thank you, Tina.
Thank you.